For this episode of Oral Bites, first episode, we're going to talk about fixing some teeth with some cracks in them. So as you can see from this photograph here, this patient has two metal fillings. We got one on the very back tooth and one on the tooth right here. The crown in the middle, you can kind of tell that's a crown because it's a little yellow. That's an older crown material. That's called a porcelain fusion metal crown. It's got a cavity underneath it, and like probably not a shocker, or maybe it is a shocker, you can get cavities on your crowns, right where the crown and the tooth meet together, and that's what happened with this case. So when you look at these teeth with metal fillings in them, on this very back one, you can see a very large crack in it. So I told the patient, look, we have to replace this crown. It's got a cavity underneath. The tooth behind it, the metal filling is very large. You've used that tooth for many, many years. You now have cracks beginning in it. They're filling over in the tooth, and the tooth is at a high risk of fracture. And then I threw out there, I said, hey, this metal filling, we could just go ahead and replace it, make everything just look nice and white, and really just restore it to a natural look. So first thing in doing all that, we gotta take it all apart. We removed the old crown, we removed all the old metal fillings, all of the cavity from the teeth, and then you put everything kind of back together. Both of these back teeth are getting new crowns on them. And so what the crowns are gonna do is gonna prevent those teeth from possibly fracturing. You know, if the patient were to bite into something on that tooth with the big metal filling in it, they run a very high risk of fracturing that tooth. And you know, then you may need a root canal on the tooth. You may have to pull the tooth. You may not be able to fix the fracture in it. So this is us. We put everything kind of back together. These teeth are prepared for crowns to go over the top of them. You can see the one tooth has had a tooth-colored filling placed in it now. It's all done. It's good to go. And then this is the final result. You can see the two new crowns cemented on those teeth. So the patient went from, you know, this where they had a couple cavities on some teeth, some cracks, teeth at risk of fracturing, to a nice natural look where, you know, everything looks good now. That's this bit of Oral Bites. Sink your teeth in that for a little bit.